Healthcare expenses, inflation, and outliving their money are the top three financial concerns that the majority of America's middle-income baby boomers have about retirement. That's according to a new study released by the Bankers Life and Casualty Company Center for a Secure Retirement. And my guest is Scott Perry. He is president of Bankers Life and Casualty Company. Thanks for taking the time, Scott. I'm sure you're pretty busy. Thanks for joining us.
It's my pleasure, Scott.
Well, this kind of study here reflects the kind of information that we've been hearing for a while about retirees. Let's start at the beginning. I mean, working in retirement is now sort of becoming the norm for Americans, and your study suggests that 75% expect that their retirement will involve work in some form, and more than half say that they'll have to work because of financial reasons. And what is behind this?
Well, Scott, clearly the economic meltdown has had a huge impact, in particularly on middle-income boomers in terms of their expectations around retirement and their retirement savings. The Banker Center for a Secure Retirement study reports that 68% have experienced a decline in the value of their retirement accounts, and 30% of those have not seen any rebound in value. And in addition to that, obviously the housing bubble burst didn't help. As you know, for many Americans, their home is their largest retirement asset, and currently, clearly it isn't worth as much as it used to be. So on top of that, you have this element of longevity. People are living longer than ever. And according to our study, middle-income boomers are worried about outliving their money once they do finally retire. So, clearly on the road to retirement, boomers in particular, as they've been, impacted by some of these recent economic events, may have to consider working longer to build their nest egg for retirement.
Which is sometimes easier said than done, because a 61-year-old looking for a gig, looking for a job, might not have as easy a time as somebody who was much younger.
It certainly presents a different set of challenges, and somebody towards the end of their career may have to consider alternatives and doing something different, especially, many people will end up in the service sector that might have been in manufacturing, for instance. Correct.
Let's talk about life expectancy. The length of retirement now is, well, it's off the charts. It's like another lifetime for many people. That also increases health care expenses, long-term care expenses. How has this study reflected that kind of information?
Well, we've seen that the recession has definitely impacted, the way people spend and what they spend on health care. According to our study, nearly 95% of all middle-income boomers have just concerns in general about their finances into retirement. But the number one concern is focused around healthcare expenses, and 80% express that as their number one concern. On top of that, Scott, many have taken relatively drastic measures to cut their healthcare costs, and I must say it's pretty alarming. The CSR study reports more than half, actually 55%, have actually said they've held off on going to the doctor. 26% are postponing an elective surgery, and 25% are changing to a less expensive health plan. And that on the surface may not be so bad as long as they know what they're getting into. Many of these less expensive health plans may require much more out of pocket than the individual may be prepared for. So, clearly boomers are spending less on all discretionary items than they today, more so than they did before the recession. Things like dining out, vacations, holidays, birthdays. But healthcare has been an area that has been particularly hard hit.
See, now retirement was supposed to be a lot better than what you're talking about here, Scott.
Right.
I think your study also says that women have been particularly affected. Can you talk about that?
Yes, it does. The center's study found that the middle-income women, those between the ages of 47 and 65, tend to have more financial concerns about retirement than their counterparts, their male counterparts. And their top three concerns were inflation, outliving their savings, and declines in the stock market. We also found, or the study also found, that women are more likely to push back their retirement age as opposed to men. According to our study, they're going to rely more heavily on their financial decision to decide when is the right time to retire as opposed to their age.
Mm-hmm.
So they'll be looking to reach a certain level of accumulation and assets before they feel comfortable claiming retirement.
Mm-hmm. So you're looking at the study, and you've got pre-retirees and boomers out there, and well, they've got essentially, I don't know, maybe half to three-quarters of what they had before the recession in retirement funds, and they're looking to somehow protect what they have left, and I'm getting even a sort of a paralysis about what to do, because the equity markets are kind of crazy right now, and I mean, what, and you've got now, I don't think I have enough money here. How can I've got to retire now. Well, what are some of the answers or suggestions that you could have for people?
That's a great point. I think the first thing, kind of the general message that I pull out of our study is that no matter where you are in the process, the adequate planning and saving beginning right now is the best defense against unexpected financial burdens that'll come later in life. And whether that horizon is 5 or 15 years, and as we said, with many people making the choice to work longer, it may be postponed. There are several things, specific things that people should be thinking about doing right now. The first, and this is a step that a lot of time is overlooked, but it's a critical one because it establishes the path for everything from that point on, is get very clear about your goals and make sure those goals for retirement are realistic, and that those expectations match the amount of money you either have or you believe you will have to support the lifestyle, the retirement lifestyle that you want. So envision what you want your lifestyle to be, but make sure that those expectations are realistic. Mm-hmm. The next is take full advantage of whatever vehicles you have through your employer if you're still working. So whether that's a 401k or you're in the not-for-profit world and you have the 403b plans available, make sure you contribute at least up to the amount that your employer matches, or ideally to the maximum that's allowed. Next, plan for risks. People spend a lot of time planning on the accumulation phase, and as important as that is, if you're not properly protected from unexpected risks, that could erode those savings faster than you had expected to. So the three most important financial risks to consider planning against are long-term care risks, inflation, and longevity. Again, mm-hmm. outliving your money or living longer than you might have otherwise expected to live. Mm-hmm. Also practice healthy living. You've done all this work to accumulate assets, to protect against risks. Make sure that you've taken care of yourself physically now so that you can fully enjoy all the fruits of your labor during your retirement years. And lastly, and I can't say this enough or clear enough, no matter whether you have $5,000 or $500,000, retirement planning is very complex. Seek advice from a retirement planning professional. A professional advisor can help create a financial plan that supports your vision for retirement. And whether you have, again, $5 or $50 or $100, $300,000, don't assume that one advice is too expensive, mm-hmm. and don't also assume that you don't have enough for somebody to want to work with you. Many advisors will provide free advice and will work with you without necessarily a fee. And again, whether they're willing to work with you wherever you are in the spectrum, usually the only requirement they have is that you're going to engage in the process and you're willing to commit to the plan that they work with you to put forth.
Very well put. This would be such a natural place to close. I'm going to ask you one more question here. Talking to the advisors right now, because obviously the work that they're doing is changing. They have to look at the whole picture differently. With the consumer in mind, there's a difference between a financial planner and a retirement planner. Can you talk about that a little bit? Because I mean, the person who has a financial planner right now might feel that they're in the right hands, but there may be something that they're missing, perhaps?
Perhaps, absolutely. Most financial planners are, and it's not necessarily wrong, but their focus is on the accumulation phase, or on the income payout phase, and probably less focus on protecting against some of the risks that an individual may incur, and especially some of the healthcare related risks. A lot of the financial retirement planners are more skilled and trained on the financial aspects of retirement, not so much trained on the healthcare related aspects of retirement, and particularly those that involve protecting against risks, as I mentioned, like an extended stay in a nursing home or home health care stay, or some of the gaps that exist between Medicare and what an individual might have to pay out of pocket.
Well, we appreciate your time. Again, my guest has been Scott Perry. He is the president of Bankers Life and Casualty Company, and fortunately, he finds time to talk to us here on Annuity News Now. Scott, it's been a great pleasure. Thank you.
You're very welcome, Scott. I thoroughly enjoyed it. Thanks.
Thank you for watching.